Hello everyone, I'm Dr. Farid. I'm a health educationist and I'll be your teacher for this subject. In this video, we're going to learn about sexual health. By the end of this lesson, all students should be able to understand about human sexuality, to be able to recognize the female reproductive anatomy and physiology, to recognize the various methods of contraceptions, how to use them, and their effectiveness. And finally, to be able to recognize abortions and risks associated with unsafe abortions. Sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease, dysfunctions, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationship, as well as the possibility of having pleasurable and safe sexual experiences free of coercions, discriminations, and violence. Sexuality is a major part of being human. Love, affections, and sexual intimacy all play a role in healthy relationship. They also contribute to your sense of well-being. A number of disorders can affect the ability to have or enjoy sex in both men and women. Concerns about infertility or fear of unplanned pregnancy can also come into play. In addition, a number of diseases and disorders affect sexual health. These include sexually transmitted diseases and cancer. In men, treatment of prostate cancer can cause erectile dysfunctions, whereas in women, cervical, uterine, vaginal, vulvar, or ovarian cancer may have sexual effects. Both the male and female reproductive systems play a role in pregnancy. Problems with these systems can affect fertility and the ability to have children. There are so many problems in men and women. Reproductive health problems can also be harmful to overall health and impair a person's ability to enjoy a sexual relationship. Your reproductive health is influenced by many factors. These include your age, lifestyles, habits, genetics, use of medicines, and exposure to chemicals in the environment. Many problems of the reproductive systems can be corrected. So some of the reproductive health includes a variety of topics such as menstruations and menopause, pregnancy and preconception care, fertility or infertility, and contraceptions. The menstrual cycle is the process by which a woman's body gets ready for the chance of pregnancy each month. The average menstrual cycle is 28 days from the start of one to the start of the next, but it can range from 21 days to 35 days. Most menstrual periods last from 3 to 5 days. In Malaysia, most girls start menstruating at age 12, but girls can start menstruating between the age of 9 and 14. Menstruation is a woman's monthly bleeding. When you menstruate, your body sheds the lining of the uterus. Menstrual blood flows from the uterus through the small opening in the cervix and passes out of the body through the vagina. And most menstrual periods last from 3 to 5 days. When periods comes regularly, this is called the menstrual cycle. Having regular menstrual cycles is a sign that important parts of your body are working normally. The menstrual cycle provides important body chemicals called hormones to keep you healthy. It also prepares your body for pregnancy each month. A cycle is counted from the first day of one period to the first day of the next period. The average menstrual cycle is 28 days long. Cycles can range anywhere from 21 to 35 days in adults and from 21 to 45 days in young teenagers. Day 1 starts with the first day of your period. This occurs after hormone levels drop at the end of the previous cycle, signaling blood and tissues lining uterus to break down and shed from the body. So bleeding lasts about 5 days. Usually by day 7, bleeding has stopped. Leading up to this time, hormone cause fluid-filled pockets called follicles to develop on the ovaries. Each of these follicles contains an egg. Between days 7 and 14, one follicle will continue to develop and reach maturity. The lining of the uterus starts to thicken, waiting for a fertilized egg to implant there. The lining is rich in blood and nutrients. Around day 14, which is in a 28-day cycles, hormones cause the major follicle to burst and release an egg from the ovary, a process called ovulation. Over the next few days, the egg travels down the fallopian tube towards the uterus. If a sperm unites with the egg there, the fertilized egg will continue down the fallopian tubes and attach to the lining of the uterus. If the egg is not fertilized, hormone levels will drop around day 25. This signals the next menstrual cycles to begin. The egg will break apart and be shed with the next period. Pregnancy is the term used to describe when a woman has a growing fetus inside of her. In most cases, the fetus grows in the uterus. Human pregnancy lasts about 40 weeks or just more than 9 months from the start of the last menstrual period to childbirth. What are prenatal and preconception care and why are they important? Prenatal care is the care woman gets during a pregnancy. Getting early and regular prenatal care is important for the health of both mother and the developing baby. In addition, healthcare providers are now recommending a woman see a healthcare provider for preconception care even before she considers becoming pregnant or in between pregnancies. A missed period is often the first clue that a woman might be pregnant. Sometimes a woman might suspect she is pregnant and even sooner. Symptoms such as headaches, fatigue, and breast tenderness can occur even before a missed period. The way to know can be emotional. These days, many women first use home pregnancy tests to find out. Your doctor can also test you. All pregnancy tests works by detecting a special hormone in the urine or blood that is only there when the woman is pregnant. It is called human chorionic gonadotropins, or HCG. HCG is made when a fertilized egg implants in the uterus. HCG rapidly builds up in your body with each passing day you are pregnant. Click on the link below if you wanted to read and learn about when and how to test for pregnancy. Home pregnancy tests are inexpensive, private, and easy to use. Most drugstores sell HPTs over the counter. The cost depends on the brand and how many tests comes in the box. They work by detecting HCG in your urine. HPTs are highly accurate, but their accuracy depends on many things. This includes when you use them. The amount of HCG in your urine increases with time, so the earlier after a missed period you take the test, the harder it is to spot the HCG. Some HPTs claim that they can tell if you are pregnant 1 day after a missed period or even earlier. But a recent study shows that most HPTs don't give accurate results this early in pregnancy. Positive results are more likely to be true than negative results. Waiting 1 week after a missed period will usually give a more accurate results. You can take the test sooner, but just know that a lot of pregnant women will get negative test results during the first few days after the missed period. It's a good idea to repeat the test again after a week has passed. If you get 2 negative results but still think you are pregnant, call your doctor. Next, how you use them. Be sure to check the expiration date and follow the directions. Many involve holding a test stick in the urine stream. For some, you collect urine in a cup and then dip the test sticks into it. Then, depending on the brand, you will wait a few minutes to get the results. Research suggests waiting 10 minutes will give the most accurate results. Also, testing your urine first thing in the morning may boost the accuracy. You will be looking for a plus sign, a change in color, or a line. Who uses them? The amount of HCG in the urine is different from every pregnant woman, so some women will have accurate results on the day of the missed period, while others will need to wait longer. Also, some medicines affect HPTs. Discuss the medicines you use with your doctor before trying to become pregnant. And lastly, the brand of tests. Some HPT tests are better than others at spotting HCG early on. So the most important part of using any HPT is to follow the directions exactly as written. Most tests also have toll-free phone numbers to call in case of questions about use or results. If a HPT says you are pregnant, you should call your doctor right away. Your doctor can use a more sensitive test along with the pelvic exams to tell for sure if you're pregnant. Seeing your doctor early in your pregnancy can help you and your baby stay healthy. Click on the link below if you wanted to learn more about reading a home pregnancy test. What if your pregnancy is an unplanned pregnancy? Ideally, a woman who is surprised by an unplanned pregnancy is in good preconception health and is ready and able to care for a new child, but this sometimes isn't the case. If you have an unplanned pregnancy, you might not know what to do next. You might worry that the father or mother won't welcome the news. You might not be sure you can afford to take care for the baby. You might worry if past choices you have made, such as drinking or drug use, will affect your unborn baby's health. You might be concerned that having a baby will keep you from finishing schools or pursuing a career. If you're pregnant after being raped, you might feel ashamed, numb, or afraid. Unplanned pregnancy is common among abused women. Research has found that some abusers force their partners to have sex without birth controls and or sabotage the birth control their partners are using, leading to unplanned pregnancy. You might wonder what options you have. So here's some next steps to help you move forward. First, start taking care of yourself right away. Take 400 to 800 micrograms of folic acid every day. Stop alcohol, tobacco, and drug use immediately. Next, make a doctor's visit to confirm your pregnancy. Discuss your health and issues that could affect your pregnancy. Ask for help quitting smoking. Find out what you can do to take care of yourself and your unborn baby. Ask your doctor to recommend a counselor who you can talk to about your situations. And lastly, seek support in someone you trust and respect. So now, let's learn about fertility awareness if you're trying to get pregnant. First, the menstrual cycles. Being aware of your menstrual cycles and the changes in your body that happens during this time can help you know when you are most likely to get pregnant. The average menstrual cycle lasts 28 days, but normal cycles can vary from 21 to 35 days. The amount of time before ovulation occurs is different in every woman and even can be different from month to month in the same woman, varying from 13 to 20 days long. Learning about this part of the cycle is important because it is when ovulations and pregnancy can occur. After ovulations, every woman, unless she has health problems that affect her periods or becomes pregnant, will have a period within 14 to 16 days. Next, learn how to chart your fertility pattern. Knowing when you're most fertile will help you plan pregnancy. There are 3 ways you can keep track of your fertile times. They are basal body temperature method, in which basal body temperature is your temperature at rest as soon as you awake in the morning. A woman's basal body temperature rises slightly with ovulations. So, by recording this temperature daily for several months, you'll be able to predict your most fertile days. Basal body temperature differs slightly from woman to woman. Anywhere from 95 to 98 degrees Fahrenheit orally is average before ovulations. After ovulation, most women have an oral temperature between 97 and 99 degrees Fahrenheit. The rise in temperature can be a sudden jump or a gradual climb over a few days. Usually, a woman's basal body temperature rises by only 0.4 to 0.8 degrees Fahrenheit. To detect this tiny change, women must use a basal body thermometer. These thermometers are very sensitive. So the rise in temperature doesn't show exactly when the egg is released, but almost all women have ovulated within 3 days after their temperature spikes. So body temperature stays at a higher level until the woman's period starts. A woman is most fertile and most likely to get pregnant 2 to 3 days before your temperature hits the highest point and 12 to 24 hours after ovulations. A man's sperm can live for up to 3 days in a woman's body. The sperm can fertilize an egg at any point during that time. So if you have unprotected sex a few days before ovulations, you could get pregnant. So many things can affect basal body temperature. For your chart to be useful, make sure to take your temperature every morning at about the same time. Things that can alter your temperature include drinking alcohol the night before, smoking cigarettes the night before, getting a poor night's sleep, having a fever, or doing anything in the morning before you take your temperature. This includes going to the bathroom and talking on the phone. So the other method will be the calendar method. So this involves recording your menstrual cycles on a calendar for 8 to 12 months. The first day of your period is day 1. Circle day 1 on the calendar. The length of your calendar or the cycle may vary from month to month. So write down the total number of days it lasts each time. Using this record, you can find the days you are most fertile in the months ahead. To find out the first day when you are most fertile, subtract 18 from the total number of days in your shorter cycles. Take this new number and count ahead many days from the first day of your next period. Draw an X through this date on your calendar. The X marks the first day you are likely to be fertile. To find out the last day when you are most fertile, subtract 11 from the total number of days in your longest cycle. Take this new number and count ahead that many days from the first day of your next period. Draw an X through this date on your calendar. The time between the two X is your most fertile window. This method always should be used along with other fertility awareness methods, especially if your cycles are not always the same length. Click on the link below if you want to learn more about the menstrual cycles and also methods in charting your fertility patterns. Some women want children, but either cannot conceive or keep miscarrying. This is called infertility. Lots of couples have infertility problems. About 1/3 of the time, it is a female problem. However, in another 1/3 of cases, it is the man with the fertility problem. For the remaining 1/3, both partners have fertility challenges or no cause is found. So some common reasons for infertility in women include age. Women generally have some decreased infertility starting in their early 30s. And while many women in their 30s and 40s have no problem getting pregnant, fertility especially declines after age 35. As a woman ages, normal changes that occur in her ovaries and eggs makes it harder to become pregnant. Even though menstrual cycles continue to be regular in a woman's 30s and 40s, the eggs that ovulate each month are of poorer quality than those from her 20s. It is harder to get pregnant when the eggs are poorer in quality. As a woman nears menopause, the ovaries may not release an egg each month, which also can make it harder to get pregnant. Also, as a woman and her eggs age, she is more likely to miscarry, as well as have a baby with genetic problems such as Down syndrome. Next is the health problems. So some women have diseases or conditions that affect their hormone levels, which can cause infertility. Women with polycystic ovary syndromes or PCOS rarely or never ovulate. Failure to ovulate is the most common cause of infertility in women. With primary ovarian insufficiency or POI, a woman's ovaries stop working normally before she is 40. It is not the same as early menopause. Some women with POI get a period now and then, but getting pregnant is hard for some women with POI. A condition called luteal phase defect or LPD is a failure of the uterine lining to be fully prepared for emergency. This can keep a fertilized egg from implanting or results in miscarriage. Lifestyle factors. Certain lifestyle factors also can have negative effects on the woman's fertility. Examples include smoking, alcohol use, weighing much more or much less than an ideal body weight, a lot of strenuous exercise, and having an eating disorder. Stress also can affect fertility. Unlike women, some men remain fertile in their 60s and 70s, but as men age, they might begin to have problems with the shape and movement of their sperms. They also have a slightly higher risk of sperm gene defects, or they might produce no sperms or too few sperms. Lifestyle choices are also affecting the number and quality of a man's sperms. Alcohol and drugs can temporarily reduce sperm quality, and researchers are looking at whether environmental toxins such as pesticides and lead also may be to blame for some cases of infertility. Men also can have health problems that affect their sexual and reproductive functions. These can include sexually transmitted infections, diabetes, surgery on the prostate gland, or a severe testicle injury or problems. You should talk to your doctor about your fertility if you are younger than 35 and have not been able to conceive after 1 year of frequent sex without birth control. You are aged 35 or older and have not been able to conceive after 6 months of frequent sex without birth control. You believe you or your partner might have fertility problems in the future, or you or your partner has a problems with sexual functions or libido. Happily, doctors are able to help many infertile couples go on to have babies. If you are having fertility issues, your doctor can refer you to a fertility specialist, a doctor who treats infertility. The doctor will need to test both you and your partner to find out what the problem is. Depending on the problem, your doctor might recommend treatment. About 9 in 10 cases of infertility are treated with drugs or surgery. So don't delay seeing your doctor, as age also affects the success rates of these treatments. Click on the link below to learn more about the infertility treatments available. Preconception health is a woman's health before she becomes pregnant. It means knowing how health conditions and risk factors could affect a woman or her unborn baby if she becomes pregnant. For example, some foods, habits, and medicines can harm your baby even before he or she is conceived. Some health problems such as diabetes also can affect pregnancy. Every woman should be thinking about her health whether or not she is planning pregnancy. One reason is that about half of all pregnancies are not planned. Unplanned pregnancies are at greater risk of preterm birth and low birth weight babies. Another reason is that, despite important advances in medicines and prenatal care, about 1 in 8 babies is born too early. Researchers are trying to find out why and how to prevent preterm birth, but experts agree that women need to be healthy before becoming pregnant. By taking actions on health issues and risks before pregnancy, you can prevent problems that might affect you or your baby later. As such, women and men should prepare for pregnancy before becoming sexually active, or at least 3 months before getting pregnant. Some actions, such as quitting smoking, reaching a healthy weight, or adjusting medicines you are using, should start even earlier. So the 5 most important things a woman can do for preconception health are: take 400 to 800 micrograms of folic acid every day if you are planning or capable of pregnancy to lower your risk of some birth defects of the brain and spine, including spina bifida. All women need folic acid every day. Talk to your doctor about your folic acid needs. Some doctors prescribe prenatal vitamins that contains higher amount of folic acids. Stop smoking and drinking alcohol. If you have a medical conditions, be sure it is under control. Some conditions that can affect pregnancy or be affected by it include asthma, diabetes, oral health, obesity, or epilepsy. Also, talk to your doctor about any over-the-counter and prescription medicines you are using. These include dietary or herbal supplements. Be sure your vaccinations are up to date. Avoid contact with toxic substances or materials that could cause infections at work and at home. Stay away from chemicals and cat or rodent feces. An unintended pregnancy is a pregnancy that is either misteamed or unwanted at the time of conception. It is a core concept in understanding the fertility of populations and the unmet need for contraceptions. Unintended pregnancy is associated with an increased risk of morbidity for women and with health behaviors during pregnancy that are associated with adverse effects. For example, women with an unintended pregnancy may delay prenatal care, which may affect the health of the infant. Women of all ages may have unintended pregnancies, but some groups such as teens are at a higher risk. Efforts to decrease unintended pregnancy include finding better forms of contraceptions and increasing contraceptive use and adherence. Contraceptions, which is also known as birth control, is designed to prevent pregnancy. Some types of birth control include, but are not limited to, barrier methods, such as condoms, diaphragms, and the cervical caps are designed to prevent the sperm from reaching the egg for fertilizations. Intrauterine device, or IUD, is a small device that is inserted into the uterus by a healthcare provider. The IUD prevents the fertilized eggs from implanting the uterus. An IUD can stay in the uterus for up to 10 years until a healthcare provider removes it. Next, hormonal birth control, such as birth control pills, injections, skin patches, and vaginal ring release hormones into a woman's body that interfere with fertility by preventing ovulations, fertilizations, or implantations. And finally, sterilizations, which is a method that permanently prevents a woman from getting pregnant or a man from being able to get a woman pregnant. Sterilization involves surgical procedures that must be done by a healthcare provider and usually cannot be reversed. The choice of birth control depends on factors such as a person's overall health, age, frequency of sexual activity, number of sexual partners, desire to have children in the future, and family history of certain diseases. A woman should talk to a healthcare provider about her choice of birth control method. It is important to remember that even though birth control methods can prevent pregnancy, they do not all protect against sexually transmitted diseases or HIV. We'll look at the first contraception methods, which is the barrier methods, in which to put a block or barrier to keep sperms from reaching the eggs. Contraceptive sponge. So before having sex, you wet the sponge and place it loop side down inside your vagina to cover the cervix. The sponge is effective for more than one act of intercourse for up to 24 hours. It needs to be left in for at least 6 hours after having sex to prevent pregnancy. It must then be taken out within 30 hours after it is inserted. Only one kind of contraceptive sponge is sold in the United States. It is called the Today sponge. Women who are sensitive to the spermicides nonoxynol 9 should not use the sponge. Diaphragm, cervical cap, and cervical shields. All of these various methods block the sperm from entering the cervix. So the diaphragm is a shallow latex cup. The cervical cap is a thimble-shaped latex cup. It often is called by its brand name FemCap. The cervical shield is a silicone cup that has a one-way valve that creates suctions and helps it fit against the cervix. It often is called by its brand name Elias shield. The diaphragms and cervical cap comes in different sizes, and you need a doctor to fit you for one. The cervical shield comes in one size, and you will not need a fitting. Before having sex, add spermicides, which is to block or kill sperms to the devices. Then place them inside your vagina to cover your cervix. You can buy spermicide gel or foam at the drugstore. All three of these various methods must be left in place for 6 to 8 hours after having sex to prevent pregnancy. The diaphragm should be taken out within 24 hours. The cap and shield should be taken out within 48 hours. Next is the condom. The male condoms are a thin sheath placed over an erect penis to keep sperms from entering a woman's body. A condom can be made of latex, polyurethane, or natural lambskins. The natural kind do not protect against STIs. So condoms work best when used with the vaginal spermicides, which kills the sperm. A new condom needs to be used with each sex act. So condoms are either lubricated, which can make sexual intercourses more comfortable, or non-lubricated, which can also be used for oral sex. It is best to add lubrications to non-lubricated condoms if you use them for vaginal or anal sex. You can use a water-based lubricant such as KY jelly. You can buy them at the drugstore. Oil-based lubricants like massage oils, baby oil, lotions, or petroleum jelly will weaken the condom, causing it to tear or break. The female condom. This condom is worn by the woman inside the vagina. It keeps sperm from getting into her body. It is made of thin, flexible, man-made rubber and is packed with a lubricant. It can be inserted up to 8 hours before having sex. Use a new condom each time you have intercourse, and don't use it and a male condom at the same time. The second method will be the hormonal birth controls, which begins with oral contraceptives. The other name would be combined pills. So the pill contains the hormones estrogens and progestin. It is taken daily to keep the ovaries from releasing an egg. The pill also causes changes in the lining of the uterus and the cervical mucus to keep the sperm from joining the eggs. Some women prefer the extended cycle pills. These have 12 weeks of pills that contain hormones, the active one, and 1 week of pills that don't contain hormones, the inactive. While taking extended cycle pills, women only have their period 3 to 4 times a year. Many types of oral contraceptives are available. Talk with your doctor about which is the best for you. Your doctor may advise you not to take the pill if you are older than 35 and smoke, have a history of blood clots, or have a history of breast, liver, or endometrial cancer. Antibiotics may reduce how well the pills works in some women, so talk to your doctor about a backup method of birth control if you need to take antibiotics. Women should wait 3 weeks after giving birth to begin using birth control that contains both estrogens and progestin. These methods increase the risk of dangerous blood clots that could form after giving birth. Women who deliver by cesarean sections or have other risk factors for blood clots such as obesity, history of blood clots, smoking, or preeclampsia should wait 6 weeks. The next method is the patch. Also called by its brand name, Ortho-Evra. This skin patch is worn on the lower abdomen, buttocks, outer arm, or upper body. It releases the hormones progestins and estrogens into the bloodstreams to stop the ovaries from releasing eggs in most women. It also thickens the cervical mucus, which keeps the sperms from joining with the egg. You put on a new patch once a week for 3 weeks. You don't use patch the 4th week in order to have a period. Women should wait 3 weeks after giving birth to begin using birth control that contains both estrogens and progestins. These methods increase the risk of dangerous blood clots that could form after giving birth. Women who deliver by cesarean sections or have other risk factors for blood clots such as obesity, history of blood clots, smoking, or preeclampsia should wait 6 weeks. Taking shots or injections. So the birth control shots is often called by its brand name Depo-Provera. With this method, you get injections or shots of the hormone progestins in the buttocks or arm every 3 months. A new type is injected under the skin. So the birth control shot stops the ovaries from releasing an egg in most women. It also causes changes in the cervix that keep the sperms from joining with egg. Next, the vaginal ring. This is a thin, flexible ring that releases the hormones progestins and estrogens. It works by stopping the ovaries from releasing eggs. It also thickens the cervical mucus, which keeps the sperms from joining the egg. It is commonly called Nuva ring, its brand name. You squeeze the ring between your thumb and index finger and insert it into your vagina. You wear the ring for 3 weeks, take it out when the week that you have your period, and then put in a new ring. Women should wait 3 weeks after giving birth to begin using birth control that contains both estrogens and progestins. These methods increase the risk of dangerous blood clots that could form after giving birth. Women who deliver by cesarean sections or have other risk factors for blood clots such as obesity, history of blood clots, smoking, or preeclampsia should wait 6 weeks. Implantable rod. This is a matchstick size, flexible rod that is put under the skins of the upper arm. It is often called by its brand name Implanon. The rod releases progestins, which causes changes in the lining of the uterus and the cervical mucus to keep the sperm from joining an egg. Less often, it stops the ovaries from releasing eggs, and it is effective for up to 3 years. You can click on the link below to learn about the implantable rod. The other method will be the intrauterine devices or IUDs. An IUD is a small device shaped like a T that goes into your uterus. There are 2 types. Copper IUD. The copper IUD goes by the brand name Paragat. It releases a small amount of copper into the uterus, which prevents the sperm from reaching and fertilizing the egg. If fertilization doesn't occur, the IUD keeps the fertilized egg from implanting in the lining of the uterus. A doctor needs to put in your copper IUD. It can stay in your uterus for 5 to 10 years. A hormonal IUD goes by the brand name Mirena. It is sometimes called an intrauterine systems or IUS. It releases progestins into the uterus, which keeps the ovaries from releasing an egg and causes the cervical mucus to thicken so sperm can't reach the egg. It also affects the ability of a fertilized egg to successfully implant in the uterus. A doctor needs to put in a hormonal IUD. It can stay in your uterus for up to 5 years. Click on the link below if you want to learn more about the implantations of IUD. And lastly, the third method will be sterilization's implant, or known as Escher. Escher is the first non-surgical method of sterilizing women. A thin tube is used to thread a tiny spring-like device through the vagina and uterus into each fallopian tube. The device works by causing scar tissues to form around the coil. This blocks the fallopian tubes and stops the eggs and sperm from joining. It can take about 3 months for the scar tissues to grow, so it's important to use another form of birth controls during this time. Then you will have to return to your doctor for a test to see if scar tissues has fully blocked your tubes. Surgical sterilizations. For women, surgical sterilizations closes the fallopian tubes by being cut, tied, or sealed. This stops the eggs from going down to the uterus where they can be fertilized. The surgery can be done a number of ways. Sometimes, a woman having cesarean birth has the procedures done at the same time, so as to avoid having additional surgery later. Whereas for men, having a vasectomy keeps sperm from going to his penis, so his ejaculate never has any sperms in it. Sperm stays in the systems after surgery for about 3 months. During that time, use a backup form of birth control to prevent pregnancy. A simple test can be done to check if all the sperms is gone. It is called a semen analysis. Click on the link below to learn more about the sterilization process. If you wanted to learn more on each of these birth control options in detail, click on all of the links below. Emergency contraceptions can be used by all women in case the primary method of birth control fails. It should not be used as a regular method of birth control. Emergency contraceptions, which is also called morning after pills, keeps a woman from getting pregnant when she has had unprotected vaginal intercourse. Unprotected can mean that no method of birth control was used. It can also mean that a birth control method was used, but it was used incorrectly or did not work, like a condom breaking. Or a woman may have forgotten to take her birth control pills. She also may have been abused or forced to have sex. These are just some of the reasons women may need emergency contraceptions. Emergency contraceptions can be taken as a single pill treatment or in 2 doses. A single dose treatment works as well as 2 doses and does not have more side effects. It works by stopping the ovaries from releasing an egg or keeping the sperm from joining with the egg. For the best chances for it to work, take the pill as soon as possible after unprotected sex. It should be taken within 72 hours after having unprotected sex. A single pill dose or 2 pill dose of emergency contraceptions is available over the counter for women ages 17 and older. So can all types of birth control prevent STIs? No. So the male latex condom is the only birth control method proven to help protect you from STI, including HIV. In fact, research is being done to find out how effective the female condom is at preventing STIs and HIV. So how well do different kinds of birth control work? Do they have side effects? All birth control methods work the best if used correctly and every time you have sex. So be sure you know the right way to use them. Sometimes doctors don't explain how to use a method because they assume you already know. So talk with your doctor if you have questions. They are used to talking about birth control, so don't feel embarrassed about talking to him or her. Some birth control methods can take time and practice to learn. For example, some people don't know you can put on a male condom inside out. Also, not everyone knows you need to leave a little space at the tip of the condom for the sperms and fluid when a man ejaculates or has an orgasm. The misuse of contraceptives is known as human error and is the main reason why effectiveness is determined by typical use and perfect use. And lastly, abortions. So abortion is the ending of pregnancy by removing a fetus or embryo before it can survive outside the uterus. An abortion that occurs spontaneously is also known as miscarriage. An abortion may be caused purposely and is then called an induced abortion, or less frequently, induced miscarriage. The word abortion is often used to mean only induced abortions. A similar procedure after the fetus could potentially survive outside the womb is known as a late termination of pregnancy. When allowed by law, abortion in the developed world is one of the safest procedures in medicine. Modern methods use medications or surgery for abortions. The drug mifepristone in combination with prostaglandin appears to be as safe and effective as surgery during the first and second trimester of pregnancy. Birth control, such as the pill or intrauterine devices, can be used immediately following abortions. When performed legally and safely, induced abortions do not increase the risk of long-term mental or physical problems. In contrast, unsafe abortions, especially those performed by unskilled individuals with hazardous equipment or in unsanitary facilities, causes 40,000 deaths and 5 million hospital administration each year. The World Health Organization recommends safe and legal abortions be available to all women. Around 56 million abortions are performed each year in the world, with about 45% done unsafely. Abortion rate changes little between 2003 and 2008, before which they decreased for at least 2 decades as access to family planning and birth control increased. As of 2008, 40% of the world's women had access to legal abortions without limits as to reasons. Countries that permit abortions have different limits on how late in pregnancy abortion is allowed. So, is abortion allowed in Malaysia? Click on the link below to find out more. And if you wanted to learn more about the guidelines in terminating pregnancy in Malaysian government hospitals, click on the link below as well. Induced abortion has long been the cause of considerable debate. Ethical, moral, physiological, biological, religious, and legal issues surrounding abortions are related to value systems. Opinions of abortions may be about fetal rights, governmental authority, and women's rights. In both public and private debates, arguments presented in favor of or against abortion access focus on either the moral permissibility of an induced abortions or justifications of laws permitting or restricting abortions. The World Medical Association declarations on therapeutic abortion notes circumstances bringing the interest of a mother into conflict with the interest of an unborn child create a dilemma and raise the question as to whether or not the pregnancy should be deliberately terminated. Abortion debates, especially pertaining to abortion law, are often spearheaded by groups advocating one of these two positions. Anti-abortion groups who favor greater legal restrictions on abortions, including complete prohibitions, most often describe themselves as pro-life, while abortion rights groups who are against such legal restriction describe themselves as pro-choice. Generally, the former positions argues that a human fetus is a human person with a right to live, making abortion morally the same as murder. The later positions argues that a woman has certain reproductive rights, especially the choice whether or not to carry a pregnancy to terms. You can read more regarding the abortion debate in Malaysia by clicking on the link below. And with that, our lesson has come to an end. Click on the link below if you wanted to read more about these topics. Thank you very much, everyone, and have a good day ahead.